Are you a pitcher looking to get stronger into laybacks? That way you can have a more stable position for your shoulder and also work towards throwing harder. I'm going to go over today one of the drills that I use to help build a more stable layback position for pitchers. That way we can take some stress off that shoulder and ultimately help with their throwing mechanics. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I've helped countless baseball players get back to throwing pain-free, get stronger, and throwing harder after an arm injury. Layback is one of the more crucial points of the throwing motion for a couple different reasons. Is one, that's where you're going to get the maximum amount of shoulder external rotation. For some guys, they might get all the way as far as high up to 170, 180 degrees, where that almost like that forearm looks like it's almost perpendicular to or parallel to the ground. That also is the same position where when you get maximum external rotation, you get the most stress on the medial elbow. So when we're talking about in the context of elbow injuries like Tommy John, really mainly like Tommy John UCL ligament injuries, layback is where we really want to be cautious of how much we're exposing them early on in that process, because that is going to be the most stress placed on the ligament in that position. Going up to the shoulder, layback is important because, again, you need significant amounts of external rotation. By and large, probably the biggest issue I see when working with guys getting into layback is that they do a really good job of just getting their shoulder rotation. They get a ton of external rotation from their shoulder. But I like to call this, they're just really cuffing it. And what do I mean by cuffing it? Meaning they're just using their rotator cuff to get into that position. So using a lot of those external rotators for your rotator cuff, your teres minor, your infraspinatus, to actively get back into that position. Now, the problem with that becomes if we do not have any engagement through our shoulder blade to help get us set to move into layback, then we can sometimes get a lot of this pinching behind the shoulder. So common complaint I hear for guys is, hey, I'm good coming out of it, accelerating, which again, more like bicep tendon issues. That's going to be more probably likely we're going to have pain. Yes, with reaching into layback, but also accelerating forward. Rotator cuff is going to be more of the deceleration phase. But when I have a guy say, hey, you know what, I'm just getting really tight and pinchy, almost right in the back of the shoulder right here. It's not going to be behind the shoulder blade. It's more so right on the back of that shoulder joint line where they're saying, hey, I get a little bit of just pinching tightness back there every time I get into layback. That's something we want to be mindful of going along the lines of internal impingement, where you're essentially getting a lot of compression on that posterior tissue, your posterior rotator cuff, maybe the posterior labrum a little bit. Over time, we want to be mindful of that, because if that happens chronically over a long period of time, you can start to have some pretty significant injuries to that rotator cuff labrum, and that can cause some other issues down the road. So in a case like this, where if I have a pitcher and I say, hey, listen, I want to see how you actively get into layback, and they go ahead and they just do this, where it's all shoulder, they might feel it right away. And then what I'll maybe do to see, hey, is this really an issue where we have to work on some scapular strength and awareness? I'll physically take their shoulder blade, put it into this down and back position here, and then I'll have them rotate. For a lot of guys, more often than not, that almost clears that pinching sensation. And when that happens, that's a good indicator to us, like, hey, listen, yeah, is there probably some rotator cuff strength to work on? For sure. Do we want to work on posterior capsule mobility? Absolutely. But a big part of this is being able to get that shoulder blade properly set and stabilized for your shoulder to rotate on. I like to say that the shoulder blade is the shelf that the shoulder rotates on. If we don't have a stable shelf, we're not going to have a stable shoulder to rotate on. So again, while we want a lot of rotator cuff strength, and that's something that I would say by and large is really always the main focus of rehab for a thrower's shoulder, we really need to make sure our scapular strength and mechanics are in a good spot. So one of the first things I'll do for guys is, without a weight to start, I'll just have them get on the side of a table here. Depending on the height of the table you have, you can have one leg off to the side, or you can just have both feet on here. For the sake of this, I'm going to show with one foot off to the side. I'm going to have my head supported here. I'm going to have one arm out to the side. I'm going to row up to the side here. So right away, with just that row, I want to see how are they able to row and set their shoulder blade. So for some guys, if it just looks like this, where you see my shoulders pop forward now, and I'm going up, now you're just going to get a little bit of that hyperabduction probably. You're really just compressing the tissues on the back of that shoulder. So I want to see, can they engage that shoulder blade down and back, set that shelf, and then row. So now that we're here, then I want to work into going into that 90-90 position. So again, once you go into flip up into that 90-90, Now it's a matter of, can they maintain that position or do they lose it right away? So it's great if they're here, but when they go to rotate, do they just lose all strength, all positioning there? So want to keep that shoulder blade engaged as I rotate up and come back down. Keeping that engagement and down. Once a guy gets proficient with that, then we'll start to add it with some weight. So we're going to be here. We're going to rotate up and down, going through a full range here. Engaging that shoulder blade, rotating down and up. So that's one progression. What I like to think about too from a shoulder blade standpoint is once you get it up into that 90-90, yes, you want some of that down and back, that retraction, depression, but it's more a matter of keeping that shoulder blade tilted backwards on your rib cage to help allow that posterior tilting of that shoulder blade for more external rotation. So what that's going to look like, if here's my shoulder blade, we think of the down and back, okay? Now, as my arm moves up and around, I want to keep that position, but I also want to keep it tilted back like this, almost like I'm seesawing back and forth as I'm moving into that external rotation. That posterior tilt of the scapula, the shoulder blade, is going to help clear room on the front of the shoulder to take stress off the bicep tendon, subacromial space, and just clear more room for external rotation. So going off the next exercise for this, we'll do the same start of that movement going to that 90-90 ER, but now I'm going to go into an overhead press just to really further stress that tissue on the back of the shoulder. So I'm going to be here on the side. I'm going to row up, 90-90. I'll go thumb up here. I'm going to press overhead, back down, and here. So one more time, rowing up to the side here, flipping up, press, back down, and here. This is one of these exercises with guys. Yes, the weight of it is important. We want to make sure we can stress this with higher weight, but I care just as much, if not more, about the ability to do with the proper scapular engagement. So again, if you're a pitcher that wants to figure out how you can get stronger into layback, go ahead and leave a comment below with any questions you have, or you can text us directly at the number below, and we'll get back to you with a personalized plan to help you achieve your goals.